So a lot of people talk about stress and how it impacts fertility. Sometimes people even think that their stress is the cause of infertility, and that's actually not the cause. We know that stress can impact health, and certainly using unhealthy ways of managing your stress is going to affect your health. Instead of focusing on things that are negative, like drinking, smoking, eating poorly, you want to focus on things that have a positive impact on your health. Anything that's going to be affecting your health in negative ways is also going to be affecting your fertility. So you want to find healthy ways to manage your stress. You want to eat clean, you want to exercise, you want to do things that make you feel good, whether it's going to the movies, reading a book, spending time with friends and family, whatever it is that you need to do to self-care. That's what I tell my patients, and that's really what the data shows. Kind of complementary to that, people often ask about, well, what about acupuncture? What about supplements? And my answer to that is, if you have a really good diet and you're being really conscientious about your diet, I think that's more important. If you want to take supplements, I'm not opposed to supplements, but the data's kind of mixed on that, and you really want to stick with evidence-based when it comes to that. Most supplements are probably not going to make or break your fertility, and there's some instances where some supplements might be beneficial, but you really want to base it on maybe blood work. So if you're vitamin D deficient, then you might need to be on vitamin D. There's some supplements that might make sense, like magnesium, because it's hard to get in our diet. Sometimes vitamin B, because that might be hard to get in your diet as well. There's some fertility supplements that people want to take, and again, there's some that might be potentially helpful and not likely to be harmful, but there's certainly some that could be harmful. In terms of herbs, herbs are really medicine, and so you want to be careful when you're taking herbs because they're unregulated. So think of herbs like medicine. They definitely are going to have a side effect and a risk, and you really need to make sure that whoever's prescribing them is able to talk to you about the risks and the benefits.